Hello, my name is Lindsay Munroe and I'm a PhD student at King's College London. Thank you so much to the organising committee for inviting me to speak at today's conference. I will be presenting my paper on automatic reorientation of 3D echocardiographic images in virtual reality using deep learning. Congenital heart disease is the most common birth defect in newborn babies and is characterized by abnormalities of the heart and the associated blood vessels. These abnormalities vary widely between patients, both across different subtypes of CHD as well as within each subtype. It is therefore crucial to understand the cardiac morphology particular to each patient when planning treatment and surgery for CHD. 3D echocardiography is used during CHD treatment planning, especially for more complex cases, as it gives a depth of field, unlike 2D images. 3D echo images can be challenging to interpret, especially since they are often viewed on 2D screens that do not allow true depth perception. To address this problem, the 3D Heart Project have previously visualized 3D echo images in virtual reality, which offers accurate depth perception in an immersive and interactive environment. However, due to the way echo images are acquired, the orientation of the 3D image is not known. As a first step, the VR user needs to determine image orientation, adding unnecessary complexity to the task of image interpretation. The goal of this study was to automate this initial reorientation step by aligning images to a standard position. We first trained a deep learning model to automatically rotate echo images to the standard apical 4-chamber view. We then integrated the model into a VR platform so that image position can be automatically corrected. Finally, we aligned the patient image to an anatomical cardiac model that will move in unison with the image as an additional guide for the user. The images used to train the model were acquired as part of a previous study at the Evelina Children's Hospital in London. The dataset consists of 47 4D images acquired from 13 patients with the CHD subtype of hypoplastic left heart syndrome. This subtype is where the left side of the heart does not fully develop. For example, the left ventricle might be too small. As a first step, we manually labeled the images by rotating each image to the standard 4-chamber view and saving the rotation angles for the X, Y, and Z Cartesian axes. Next, we ran several experiments, training an 18-layer ResNet using 3 different loss function strategies. The loss functions we evaluated were regression with mean absolute angle error loss, classification with cross-entropy loss, and regression with geodesic loss. The best loss function strategy was then adopted, and additionally, 3 different pre-processing strategies were investigated: 2D, 2.5D, and 3D. Finally, we integrated the model with the lowest mean absolute angle error on the test set into VR and aligned to the anatomical model. The best performance was achieved using 2.5D pre-processing and classifying discrete integer angles with cross-entropy loss. This deep learning model achieved a 9-degree mean absolute angle error on the test set, with a ground truth initial angle range of between minus to plus 150 degrees. An example echo image that has been automatically reoriented and aligned to the anatomical model can be seen here in this slide. The model is sufficient for the majority of images in our dataset for our use case, bearing in mind there is a high variability between patients in our dataset and we have a small sample size. Automatic reorientation can also be used to display common views, which may be useful when communicating findings to other clinicians. There are 2 main limitations to this study. First, due to time constraints, our dataset is small and of only one CHD subtype. We do have access to more data and other subtypes of CHD, so there is the possibility to increase both the size and variety of the training dataset in future. Second, in general, the mean absolute angle error increases as ground truth angle increases. For our use case, this was not too much of an issue, but for other use cases, the approach could be further developed so that the error is consistent across all ground truth angle magnitudes. In summary, we trained a deep learning model to automatically reorient 3D echo images to the standard apical 4-chamber view. We selected the model with the best test set performance, which applied 2.5D pre-processing and classification with cross-entropy loss. We then successfully integrated this model into a VR platform and aligned the reoriented patient image to an anatomical model to guide the user. I would like to give special thanks to the National Institute for Health Research and the 3D Heart Project, to the Wellcome Centre for Medical Engineering, the CDT in Smart Medical Imaging, as well as to my co-authors for all their hard work and support. Thank you for listening.